Hi, Deanna. I'm India Care Coordinator here. The doctor told me you're interested in quitting smoking before your surgery.
Yes, the surgeon told me that smoking can increase my chance of getting an infection, healing time is longer, and the potential for complications is greater because I smoke.
So it sounds like you're ready to quit.
Yes, I know it's going to be hard because I've been smoking since I was 19, but I think it's time for me to do something about it. I'm worried about quitting and it's giving me a lot of anxiety. My dad has emphysema too from smoking, and seeing him get worse makes me think about my own health and my own smoking. My brothers and my sisters and I all have to pitch in to take care of him.
Sorry to hear about your dad. It's really tough seeing your loved ones go through something like that. Quitting is one of the best decisions you can make for your health. Have you tried quitting before?
I did, maybe a year or so ago for maybe a week. I'm really worried that I can get sick just like my dad, so I really want to quit. And I know it will help with the recovery from my surgery too.
Anxiety before surgery is common. What's important is that you're taking steps today to help you quit smoking, which will improve your recovery and your overall health. How many times in the last year have you thought about quitting?
At least a few times. With my dad and my surgery, my smoking keeps coming up. My family has been pressuring me a lot to quit. I don't want my kids to go through what I'm going through with my dad.
Yeah, that's understandable. To be successful in quitting, we can take steps to understand why it's hard to quit. Cigarettes are addicting in 3 ways. The addiction is emotional, behavioral, and physical. Can you tell me how you feel when you smoke?
I usually smoke when I'm worried or when I'm stressed out. It's a way for me to step away and have some time for myself.
It's common to use smoking to cope with stress and anxiety. Tell me more about when you smoke.
Well, my first cigarette is in the car in the morning. I like to have my coffee after I smoke. I usually start my day like that every day.
So it sounds like you have your coffee and you smoke together. That's kind of your routine. One way to help you quit is to change up your routine. What can you do differently to change up your morning?
I could maybe take a different way to work and drink tea instead of coffee.
Yeah, those are some good ideas. Are there other places or times you usually smoke?
When I get off work, I always smoke when I'm driving. I smoke on the way to and from work. The car seems to be the place I like to smoke. I smoke my breaks at work, and there's a few of us who go out together. My supervisor usually comes out with us, and we get a longer break if she decides to have 2 cigarettes. And at night, after a long day, I smoke just to reflect on what I have to do in the morning.
So what I'm hearing is that you smoke in the car, on your breaks at work, and in the evening. So how do you feel when you aren't able to have a cigarette at work or at the end of the day?
I'm usually pretty irritated if I don't get my morning break to smoke. At lunch, I usually end up smoking a few cigarettes to make up for it if I don't smoke in the morning. I'm really crabby when I can't smoke. I get really annoyed and impatient with a lot of people. It can actually ruin my whole mood for the rest of the day.
So it sounds like you get frustrated and irritated when you can't smoke.
Yes, for sure. That's why I feel like it's going to be hard not to smoke. I know that's from my addiction to cigarettes. I really need a lot of help to quit. I've tried to do it myself, but it's really hard and I need help.
Quitting smoking can be hard. Some people use substitutes to keep in their mouth and hands instead of smoking. Instead of smoking, is there something else you could do?
Can maybe use toothpicks, gum, or candy. I know someone who used candy and gum as a substitute when they quit. They were always eating those hard candies and had them all over their car and all over their house. For my hands, I could use a pen or a stress ball or the spinner things too.
Yeah, the fidgets, those are fun. Using substitutes can be a good tool for those who miss the motion of smoking. Distractions are activities that take your mind off of smoking. Can you think of anything to do to distract yourself?
Well, I don't have time to do many activities. I'm usually stressed out, so I just smoke.
It sounds like you're busy with work and family obligations. If a cigarette was not available to you when you are stressed, what could you do during stressful times?
I could maybe take a walk, take a short break from everything, turn off the TV, unplug the cell phone, and just try to relax.
Yeah, those are some really good ideas to cope with stress. Can you think of anything else you could do?
Maybe spending time with my friends, playing a game with my kids, or watching a good movie.
Being mindful of your health by getting enough sleep at night and eating healthy is another thing you could do.
Well, I know getting rest and eating healthy is important, but with my busy schedule, some of those things can be really, really hard to do. But my kids and I are learning how to cook, so maybe we can cook meals together at home.
Yeah, that's a really good idea. Thinking of distractions and substitutes on your own, there are many ways to get support in helping you quit. Have you thought about using any medications?
No, I haven't, but a friend of mine used medication to help her quit. But she said she started to get weird dreams as a side effect.
Side effects from smoking cessation medications can happen to some patients. However, there are other medications that we could try that don't have side effects like that. Knowing this information, would you be interested in trying any other medication?
I don't want to get weird dreams, but I'll try other medications.
All right, I will let the doctor know you would be willing to try something. The provider will go over how to properly take them, and the dosing instructions are easy to follow. And if you do have side effects or any questions, you can always call us here at the clinic.
So if I have questions or concerns, I can call you here at the clinic.
Yes, we're here to help support you. Together we have come up with tools to help fight those smoking urges. We should pick a quit date and steps to get ready to quit.
I think Monday's a good day to stop quitting.
Yeah, that's a good day. What I'm hearing from you is that you're really ready to quit now based on how close your quit day is. What would be helpful to remind you to quit on Monday?
I could write it down and post it all over my fridge. I could clean out cigarettes from my car, my purse, and my jackets, and just get rid of all the cigarettes in my ashtray. I could do that this week on my day off.
Yeah, that would be a good time to do that. The urge to smoke will be strongest the first few weeks. If you're able to remove those items from your home and your car, you can help lower the urge to smoke.
Yeah, I could see how that'd be really helpful.
You are making the right decision to quit. Have you ever tried or thought about using any nicotine replacement therapy like a gum or a lozenge?
No, but my sister used nicotine gum to help her quit. But my kids would always ask her for a piece, so I'm worried that my kids might get into my gum.
Yeah, it's really important to make sure your kids don't get their hands on the gum. Having a conversation about you quitting smoking with your kids and what the gum is used for would be a way to let them know that it's kind of like medicine to help you quit.
My kids will be super happy to hear that I'm quitting. They're always telling me to quit.
That's great to hear. We could get you started on gum with your medication. When you use medication and gum together, your chances of successfully quitting will increase.
It worked for my sister, so I think I could try it. Is that covered by my insurance?
Yeah, most health insurance companies are now covering gum. So in the morning, instead of reaching for a cigarette on your commute, you could pop a piece of gum in along with taking a different route to work. So you said you smoke on your breaks at work.
Yes, I really look forward to my morning breaks.
I want you to know that you're in control and it's your decision to smoke or not. When you are having the urge to smoke or are around others who smoke, think of some distractions. Is there anything you can do during that time instead of going out to smoke?
I don't know. I have a lot of games on my phone, so I could just play one of the games.
Yeah, that would be helpful. Replacing smoking with healthy behaviors will improve both your physical and mental health. Together we have thought of some things to do instead of smoking. What do you think you could do while you're at home instead of smoking?
I don't know. I'm usually so busy making dinner and cleaning and making sure the kids' homework is done. And I usually spend a few evenings at my dad's house a week to help him out. I really don't have a lot of time at the end of the day for myself. I get maybe 20 minutes.
Although that's not a lot of time, you could take that time you used to smoke and do something.
Yeah, I could maybe bead instead of smoke. I do that a lot when I watch TV. Also, my friend and my sister are there for support, so I can just check with them to get some support because they were able to quit.
That's really good to have support. That's another important step in quitting. Reaching out to people is definitely helpful. There's also online support groups such as Quit Connections a Facebook support group provided by the American Indian Cancer Foundation. Do you use Facebook?
Yes, I have a Facebook, but I've never heard of that, so I'm going to look them up.
Okay. There's also a quit plan from Clearway that has a guide to help you quit. There are a few short worksheets here to help you through this. Remembering to write down your quit date and the reasons to quit, along with like specific activities, will be helpful. And also putting these up somewhere where you see them every day. Do you feel like you're more prepared to quit now?
Yes, I'm ready to quit.
Awesome. Here's a Quit Connections magnet to help remind you of your motivation to stay smoke-free. I'll follow up with you on Tuesday, see how things are going. So I would love to hear from you then.
Awesome. Thank you.